Hello everyone, my name is Luke Haydock. I'm a veterinarian and a resident in veterinary anatomic pathology here at the University of Guelph, and today I'll be giving a brief summary of my work on bronchopneumonia with interstitial pneumonia in beef feedlot cattle. So for a quick background, bovine respiratory disease, as many of you will know, is the leading cause of morbidity and mortality in beef feedlots, and it's estimated that anywhere up to 21% of cattle may suffer from BRD at some point. Bronchopneumonia with interstitial pneumonia is a novel presentation of BRD that's yet to be fully characterized. It's also known as upstairs-downstairs disease due to the presence of bronchopneumonia in the bottom half of the lung and interstitial pneumonia in the top half of the lung. It is estimated that it may account for up to 11 to 17% of BRD-related mortalities according to our preliminary data. So what do the two different forms of pneumonia that we see in BIP actually mean? So breaking them down into the constituent parts, bronchopneumonia is usually infectious in origin in cattle, and it can be caused by a wide variety of different viral, bacterial, and mycoplasmal agents. There's often considerable synergism between these pathogens with a primary viral infection, then predisposing to a secondary bacterial infection. And there's also significant interplay with the environment, such as stress of handling, management, transport, which means that the first few days to weeks after arrival in a feedlot is the highest risk period for developing bronchopneumonia. And it can be recognized grossly as usually as dark red, firm lung, which has pus in the airways and either microabscesses or large abscesses throughout the lung tissue. On the other hand, interstitial pneumonia is most commonly toxic in origin when it's seen in cattle, and for those working in the feedlot environment, you'll most commonly recognize this manifesting as acute interstitial pneumonia. You recognize this most frequently in well-conditioned yearlings with a particular predominance for affecting heifers. The agent that actually causes AIP in the feedlot environment is still yet to be definitively identified, but when we see this condition, very similar condition in pastured cattle, the putative cause in most cases is 3-methylindole, which is a metabolite of an amino acid which is found in high levels in lush pasture. So putting those two things together, animals dying of BIP have a combination, as mentioned earlier, of bronchopneumonia in the bottom half of the lung and interstitial pneumonia in the top half of the lung. This seems to be particularly prevalent in feedlot cattle, so much so that it has been historically referred to in the literature as feedlot interstitial pneumonia. And part of our research is then set out to determine whether this is simply just a chance concurrence of two unrelated disease processes, or if these two processes are linked and this is actually a unique disease entity. So our findings to date suggest that it is in fact a unique disease entity, with some of the most elucidating findings being that the bronchopneumonia often precedes the interstitial pneumonia, and this has led to our primary hypothesis as to what causes BIP, and that inflammation may be affecting the metabolism of or increasing the effects of toxins, and we are currently developing further work and experiments to prove this theory. On an epidemiological basis, we've found that BIP seems to behave uniquely and has a predisposition for affecting steers and has a predisposition for developing poorly thriving cattle with chronic and recurrent illness who have received multiple treatments for respiratory disease during their time on the feedlot. Most cases are clustered in the late winter to early spring period, and there is a predisposition for this disease to cause mortalities in the mid to late feeding period, which is obviously very frustrating for producers, being as a lot of time and energy has gone into raising these animals at this point. So the significance of this work is that we feel we are beginning to establish BIP as a distinct entity that behaves separately to its constituent parts. We've managed to begin to describe the nature of disease and also identify risk factors to highlight animals in the feedlot population who may be at risk of developing the disease. We feel that understanding the cause of BIP will help us describe a unique disease process in cattle that links inflammatory and toxic disease, as well as provide a lot of vital information regarding management practices and treatments that may help mitigate the effects of BIP on cattle health and production. So that's about all I have to say today, but I'll finish off just quickly by thanking my advisor, Dr. Jeff Caswell, and part of my advisory committee, particularly Dr. Kent Fenton, and also thank you to NSERC and the Beef Cattle Research Council for providing the funding for this research. Thank you.